welcome to our TED Talks. I'm Erin Hamilton.
And I'm Toby Moe.
Today we will explore ADHD, or Attention Deficit Hyperactivity Disorder, common misconceptions about ADHD, and specific cognitive strategies that can help improve attention. We interviewed Dr. John Lear, an adult and child psychiatrist who went to the University of Minnesota's medical school. He is more involved in the quick diagnosis and medicated treatment of ADHD, primarily because his patients are referred from general practitioners and teachers who feel medication is a good option for this person. So, first we aimed to understand more about what ADHD is today. The term attention deficit in ADHD is actually quite deceiving. In reality, people with ADHD attend to everything. For example, driving becomes the ultimate test of divided attention because everything attracts their attention. An interesting thing we learned is that the definition of ADHD will be different in the DSM-5. It will specifically address the misconception that ADHD does not continue through adulthood. Longitudinal studies have found that ADHD does not fade at a specific age. In the past, there are 3 different subtypes of ADHD: primary inattentive, primary hyperactive impulsive, and combined inattentive and hyperactive impulsive. However, the diagnosis of the disorder will not be limited to one of these 3 disorders. Dr. Lear attributes this to the fact that the inattention is the most important aspect of the disorder, and hyperactivity is not always easy to assess, especially with children, because children change with time and do not always meet the criteria for one subtype several months later. ADHD is highly prevalent among children, at 7 to 10% of children in the United States, and tends to be more common in boys. Another interesting thing about ADHD is that it is slightly less genetic than height. Many parents go through life without being treated for ADHD, and luckily the DSM-5 will better account for the populations of adults with ADHD. A surprising thing we learned from hearing about Dr. Lear's experience is the amount of inmates with ADHD. About 50% of prison's population has ADHD. However, they can't be treated because of the ban of stimulants in jail. Stimulants are banned because they have the ability to be abused. However, Dr. Lear feels there is a false stigma about stimulants. It is common to see media coverage that says Adderall is addictive. However, stimulants can only be abused by injecting or snorting them. Now Toby will talk more about how medication can help individuals with ADHD.
Benzedrine was first used in 1947 to treat spinal headaches after a spinal tap was administered. Patients started calling it the homework pill or the math pill because children realized while they were bedridden that it helped them concentrate on their homework. From this first stimulant medication, Benzedrine, have come the 2 most common forms of stimulants, Ritalin and Adderall. Many parents worry about the use of stimulants to treat their children, but it has been demonstrated to be effective in over 500 studies, according to Dr. Lear. Compared to other psychiatric disorder medications, the effect size for ADHD towers over those of depressive medications or antipsychotics at 0.95 to 1.1. Patients most often report a sense of calming and a relaxation feel when taking the medication. While it is not predictable as to which drug will work best, a 70% rate of each working means that if one does not, the other likely will. While medication may control for symptoms and behaviors of the disorder, does it truly alter cognition? Gualtieri and Johnson in 2007 found that medication did not normalize cognitive performance. Unmedicated participants of their study scored 15% lower than healthy controls in a battery of cognitive tasks, while medicated individuals still scored 10% lower. This suggests that cognitive deficits are still persistent regardless of medication therapy. So, what other treatments can be administered in order to improve cognitive outlook?
People with ADHD also have other needs that should be addressed in treatment. These include social skills, anxiety, oppositional and conduct behavior, and self-esteem. Medication can help some of these problems, but it is often beneficial for people with ADHD to participate in therapies such as CBT or music therapy to help them gain functional skills that promote academic and personal success. Self-regulation is the biggest skill that can be worked on to benefit people with ADHD. Dr. Lear talks more in this clip about the importance of supplementing medication.
One of the biggest concerns I probably encounter with treating ADHD is I can do the medications. And so the problem that we have is trying to press upon families that this is a multifactorial approach. And you really need to have everybody involved as a team. And it's not just the medications. And one of the great illustrations, I think, again, going back to Barkley, he says that he thinks of having ADHD. He tells parents, imagine that your child who has ADHD, it's kind of like them having diabetes. This is something you have to be on all the time. If your kid has diabetes, you don't just say, well, it's okay, go ahead and have an ice cream bar and a chocolate soda and something like that. No. That's what he says it is with ADHD. You really need to have a comprehensive approach. And so this is kind of funny because this is the handout now, and I give my medication list of people and choose which one we're going to do, and then I've got my instructions written out. I didn't used to do this. I would want to individualize it for each patient and each thing. Guess what? The parents have ADHD. So they'd get home with my handwritten stuff and go, I don't get it. So now it's all printed out very clearly. I go with them, highlight what they can do, give them 2 copies, one to the kid, one to the parent, because one's going to lose it. Don't give them both, and then the kid gives it to the parents like, nope, you got to take these home separately so that you can get it caught. But then this is my thing, and it talks about, learn about ADHD. We've got great websites now because ADHD parents and kids don't like to read books. That's the whole problem. So what are
Since people with ADHD have impaired cognitive functions, they often have an impaired ability to manage their time and are very distracted. Using things such as clocks and timers will help them develop a better sense of time. Visuals and charts around the house are also very helpful. Another example of how to improve tasks of people with ADHD is to touch instead of talk. This means that instead of giving a lecture to a child about why it's important to do their homework and get back to work, simply tapping the desk without a word is more effective.
People with ADHD also have impaired working memory. They are more likely to engage in risk-taking behavior and are twice as likely to be involved with substance abuse. While there is no single dysfunction that characterizes all children and adults with ADHD, the dysfunction occurs with impaired attention, reward response, and executive functioning. The difficulties in the executive functioning include response inhibition, difficulty modulating behavior in response to reward and punishment cues, and overall slow processing speed. In this clip, Dr. Lear discusses more about cognitive processing.
We're talking now about cognitive differences in folks with ADHD, and one of the concepts that, again, is pretty new to treating physicians is working memory. And how do those things kind of fit together? Again, I think we're not real good at understanding that, but some of the images that we think of is the nonverbal working memory. And when I say it, as a treating physician, I don't understand that as well as some of the psychologists who do the testing and the evaluation. But the nonverbal working memory as a way of seeing yourself doing these different things. And the verbal memory is as you actually talking to yourself as you do these things, and to have some increased efficiency with that. So when I'm trying to talk to families about working memory, I'll say, Johnny, go upstairs, brush your teeth, pick up your homework. Some people would say that there's actually reverberating loops that keep those things going. And Johnny, with his ADHD, brushes his teeth and then forgets what the other 2 steps were. And some of our medications, in particular, these are actually some of the non-stimulants, as well as the stimulants, seem to help with that working memory. And I describe it as it keeps the loop going. So after he brushes his teeth, he's like, oh yeah, and I'm supposed to bring my homework down. those kinds of things that can be helpful with that.
As Dr. Lear mentioned, a lot of the responsibility falls on the parents. It is important that parents educate themselves and others to form a team between the child, family, teachers, neighbors, and coaches. These teams need to be collaborative and come up with a plan of action and then implement it for the child. We hope you learned more about ADHD, and thank you for watching our video.